You've heard of these things, I'm sure, but you probably never heard of this. Well, what we do is we work on all the medical equipment in the hospital. So we have biomedical engineering in our name, but we're not biomedical engineers. Engineers develop and make equipment for manufacturing for hospitals and patient use, or they do prosthesis for people that have limbs lost or anything else like that, or they can do genetics and DNA research and things like that. So if you're looking for that, that's not us. What we do is we repair that stuff, especially the part that the engineers make or design and have made. So that's what we do through the hospital, and it ranges from radiology to anesthesia to OR, lab, PT, respiratory therapy. This might be a career choice for you in the future. And speaking of the future, it is a good career choice because in our future, there is a shortage of biomeds across the country and around the world. Anywhere that there's hospital equipment, patient contact, equipment, analysis, biomeds are needed. So that all over the place. So if you want to go to Europe and be a biomed, get trained, and we can send you to Europe to be a biomed.
So Joe, just to clarify, I know earlier we talked about if they like to travel, you travel within Northwestern Michigan region, but if they work for a company or a nonprofit, they could travel all around the world.
Yep. Manufacturers of medical equipment are all around the world. Radiology equipment, say Toshiba, they have their service training centers, or I can't remember, they're either in Australia or Japan. So if you got to work for Toshiba, they would send you over there for training. Company like Zeiss, who makes surgical microscopes, or Draeger, you might go to Germany for training. And then if you actually work for a manufacturer, which is an option, in doing service for their equipment that's located in hospitals and facilities, then they may send you, someplace anywhere around the world. Generally, you'll get put into a service region, such as Western Michigan or the UP or Detroit or Chicago, or if you want to move, you need to be in San Antonio or New Orleans or Florida or England or Japan, wherever their need is going to be. If they have an open position, you can apply for it and get sent there. So that's a great opportunity there. Other places you might work, as I said, I work here at Munson. I've been here for over 23 years. I work in Munson Healthcare, which is all 9 of our hospitals that we're either affiliated with or own. You could work for a third-party company who contracts services with a hospital, and you would, still work in the hospital, but you're employed by that company. Other aspects are, like I said, manufacturing. We already talked about that one. If you get some experience as a biomed, you could go in on your own and have your own business. There's a huge call for biomeds to service veterinarians and other small clinics. So,
what kinds of things do you do throughout the day?
Well, what I do, like this week, I've been going over to Frankfurt and doing preventative maintenance on all of the medical equipment over there, from OR to lab to ER. So, in a given day, I could be come in, to work on a centrifuge for lab and be called to go upstairs to the cardiac cath lab where they're working on putting, cleaning out people's arteries going into their heart so that they don't have heart attacks and things like that. So no day is ever the same for biomed, generally. So it's quite interesting work. One other aspect with the work, is it very science-based? Yeah. What sets us apart, Camille, from like say a general IT person is that we have an anatomy and physiology background. It's important for biomeds to know how that medical equipment interacts with the human body, and how it is being used, how it's supposed to be properly used. So those are a couple aspects. We're also, I have chemistry and physics in my degree. We also strong, lot of interpersonal interaction with professionals such as nurses, which I'm sure you've heard through the pandemic, the stress that nurses are under, dealing with the patients that they're having to deal with. We go up and we take care of the equipment that they're using with those patients. So we need to know some of the psychology on how to carefully handle talking with them and understand that they could have just had a patient expire and pass away. And we need to make sure that we understand that situation, that if a nurse is snippy with us or very sad, it's not something necessarily we did, it's how they're reacting, and we got to be able to react to that. So there is science and psychology to our job too.